everyone. It's great to see you all here today. I am sure we are going to have more people join us as we go, but in the interest of time, I wanted to go ahead and get started. My name is Christy Wick. I am a nurse practitioner and on faculty at UTC School of Nursing. Today's goal is to introduce you to one of our new grant initiatives, which we have named Roadmap. It stands for the Rural Health and Older Adult Interprofessional Mobile Health and Workforce Recruitment Program. As we go, I'd like to go ahead and let you know, because I'm sure it's a burning question, about which counties that we will be covering. And initially, our scope includes the following rural counties, and we'll talk a little bit more about these counties in a few minutes. But these counties were picked because of the need for rural healthcare access, older adult care, caregiver support, and the higher rates of dementia or other chronic diseases in these counties. And so we're going to start off with some introductions, and then we'll go through the background and specific information and how you can help, and then our next steps. If you don't mind, as we go, if you will put your name and information in the chat, that would help us a great deal, especially if you see yourself as someone who would like to be a core partner and collaborate with us. You're also welcome to send us a direct email, which Stephanie Blaine, our project manager, will put in the chat as well. So first, I'd like to start out with some introductions. We have several of our faculty members here online today, and they're going to tell you a little bit about themselves and their role for interprofessional healthcare. First, Dr. Scott, if you're online, if you wouldn't mind introducing yourself.
Good morning. I'm Dr. Kathy Scott. I'm the program director for the undergraduate social work program here at UTC. And our program trains undergraduate students in the basic skills, knowledge, and assessment skills for working with individuals in need, giving particular emphasis on those who are the most vulnerable in our communities and in our society. These include children, individuals living with intellectual disabilities or special needs, and older adults. Some of the initiatives that we've done outside of the classroom, we've partnered with other departments on campus with older adult initiatives in the community. We've done activities even with children in school-age children. So our students are excited at the opportunity to get out and do some enriching work and looking forward to it.
Thanks, Dr. Scott. Erin Melhorn with Occupational Therapy.
All right. Hi, I'm Erin Melhorn with Occupational Therapy. We have an occupational therapy doctorate program at UTC, and our goal is to just train clinicians who are able to keep individuals in the community as independent and as safe as possible. So in particular with the older adult population, we have a lot of initiatives related to falling. So we lead a lot of matter of balance classes. Last week, we did a car fit event in partnership with Erlanger Trauma and Red Bank Fire and Police Departments and the Tennessee Trucking Association. And so my goal is just to get the students out and learning and helping as many people as possible be independent and healthy as they age.
Dr. Letitia Tony.
Hello. I teach the community health nursing course here at UTC. We have a focused effort to expose our students to nursing care in the community. Some of our clinical sites include the Chad Foundation, where we provide care to primarily individuals who are homeless. We go into Hamilton County Schools. We also provide care to individuals at Silverdale Detention Center. We recently added an elderly housing complex where we will be going to that community to provide foot care for those individuals, as well as providing some prevention and promotion health topics, teaching topics to members of that community. We also go to Welcome Home, where they're a facility that provides palliative and hospice care to individuals who are homeless while dealing with a serious health condition or a terminal health condition. So I'm looking forward to participating in this effort headed by Dr. Wick.
Dr. Baptiste, do you mind introducing yourself quickly?
Absolutely. Thank you, Dr. Wick. My name is Shawani Howard-Baptiste. I serve as the Vice Provost for Academic Outreach here at UTC. My background is in public health, so Dr. Alakam and I have a lot of experience working together and have just done a lot of interprofessional work throughout the College of Health Education and Professional Studies. So excited to expand Roadmap throughout the state and serve our community.
Thanks so much. And finally, Stephanie Blaine.
Good morning or afternoon, whatever it is for wherever you are. My name is Stephanie Blaine. I am the project manager for Roadmap, so I get the opportunity to work with all of you all, and I am the one behind the emails that you get. So it's nice to see all of you.
So to provide you all with a little bit more background, in 2022, Governor Lee announced $230 million in health resiliency grants to transform care and services in Tennessee. And this is the pot of money that our grant comes from. We have $2.6 million to develop a mobile health program for older adults and caregivers as the primary focus. You can see at that time, Speaker of the House, Cameron Sexton, noted that Tennessee's considerable growth means more of our communities require additional resources to meet their evolving needs. And this is for sure the case when it comes to our older adults. Here at the University of Tennessee Chattanooga School of Nursing, we are deeply committed to successful aging for all of us because it really is the one thread that we all have in common. As long as we are alive, we are aging every single day. And we want to make sure that we're doing that while enjoying our best life, enjoying our best quality of life, as long as our best physical, mental, and social health as well. Just to make sure we're all on the same page with the challenges that we have here in Tennessee, we know that there is an overall population increase of older adults age 60 plus across the state. In some counties, the rate is higher than that. Particularly in Southeast Tennessee, we're seeing a rate of population increase of older adults 65 and over at about 5% year over year. There are known to be 42% of our older adults who have 4 or more chronic conditions, 38% with a disability. You all are well aware of the housing challenges across the lifespan, but certainly we have challenges for our older adults finding affordable housing and many without reliable transportation. We also have what I feel is a low number, greater than 30,000 grandfamilies. And I really think it's much, much higher than 30,000. But these are grandparents taking care of grandchildren, or vice versa, grandchildren taking care of grandparents. And then a mix of everything in between with our sandwich generation of middle-aged adults taking care of children, grandchildren, parents, and sometimes grandparents. We have workforce challenges like the rest of the nation. In Tennessee, we have 37 board certified physicians who are certified in gerontology, or the study of aging. We predict that there will be a need for 827% increase to meet the demands of our older adult population by 2050. In the same way, we're going to need an increase in our home health aides as another example. So it's important that we get out in the community and call attention to the opportunities that there are for people to be trained formally to help take care of older adults. Our 2021 dementia data showed that 140,000 of our older adults in Tennessee will be diagnosed with some type of dementia by age 2025, or excuse me, by year 2025. That's a 16.7% increase in 5 years. And we see somewhere between 8 to 14% in each county of older adults who are diagnosed with some type of memory loss or cognitive disorder. And so you can think about, as the population increases, that percentage is going to increase as well. so too will the need for caregivers. It takes about 4 caregivers to take care of one person with moderate to severe dementia that's community dwelling. So we have a significant need to take care of our caregivers as well. On the right, you'll see that in Tennessee, we know of at least 367,000 caregivers who care for someone with dementia. That results in 496 million hours of unpaid care to the tune of $7.7 billion in total value. Of these caregivers, 67% have chronic disease themselves that they're trying to manage. Over 30% report significant depression, and 17% report poor physical health. Coupling all of this with our overall health in Tennessee from America's Health Rankings, we know that Tennessee ranks 40th in clinical care, 41st in the ability to avoid care due to cost, 33rd in the amount of people who have a dedicated healthcare provider, and with preventable hospitalizations. So all of these markers or metrics are compared with other states across the country. So we have some work to do here in Tennessee. According to the Tennessee Healthcare Capacity Dashboard, we have multiple counties in our Southeast Tennessee regions, either without a hospital or without an emergency department or both. And so because of this, we have a huge challenge with healthcare access. One of the ways that we feel we can help contribute to improving our healthcare outcomes and our quality of life for our older adults and caregivers is to use a mobile health clinic along with programs to get to these rural counties and provide some care and support for older adults and caregivers. This is the type of unit that we should have on property in the fall, but ready to launch in January of 2025. It's a 30-foot custom van cab mobile health clinic, which will be ADA compliant, have wheelchair accessibility, and be able to provide full primary care along with assessments for occupational therapy, physical therapy, do social screenings, all those type of things. And a lot of our services may not be held directly on mobile clinic unit, but rather in whatever site that we are partnering with. So why mobile health? We know that there is an increased access to healthcare. The mobile health units are more convenient and are accessible to neighborhoods that can't necessarily get to bigger urban areas such as Chattanooga, to allow people access to specialists or very specific healthcare needs that they may have, or even just normal preventative care. And mobile health units, by and large, can provide a holistic approach to healthcare, being able to manage many different concerns or issues, health problems, social problems. We can provide a broad range of services. One of the reasons that I introduced you to all of our interprofessional faculty is because we recognize that interprofessional collaboration is very important and key to the quality of care for everyone, not just older adults. But older adults specifically have more chronic and complex conditions, adding to the fact that often there are caregivers involved or other family members. And so being able to use experts in all different types of healthcare helps improve not only our quality, but it makes our processes and our ability to provide that care much more efficient. It also enhances patient safety and health outcomes. So being able to provide expertise in all these different areas means that we can each work at the top of our expertise and the top of our licensure and provide the best holistic care that we can in a mobile setting out in the community. So thinking about specifics, our target population, as I mentioned, is older adults and caregivers. Our short-term goals are to increase the access and health literacy of older adults and caregivers in each county, as well as help navigate resources and establish a trusting relationship for care. Our long-term goals include decreasing social isolation, decreasing caregiver burden, and increasing that use of community resources. Hopefully, as we go, we will decrease use of emergency room visits and decrease the amount of hospitalizations that older adults have across these counties. One of the things that we are not intending to do is to take the place of any current healthcare provider or resource or organization that's out in the community. We really want to align with each community and help fill the gaps and provide support where we can. And this may mean seeing someone in the community and getting them a referral to a primary care provider in the county or somewhere nearby, or getting someone hooked up with a food bank nearby as well. So all of the goals that we have include supporting each county and the people within the county as best we can. We would like to partner with senior centers and other community partners in each county where possible. Senior centers are ideal locations for mobile health units, but also for older adult programs, because you're already set up in providing a welcoming environment to older adults. You have many programs that help maintain health, but build a sense of community, along with offering opportunities for social engagement. All of these things significantly enhance the overall well-being of older adults in our communities. And therefore, our primary goal is to partner with senior centers to find out what the needs are in your particular county and help provide that extra support and programming. So our collaborating partner wish list, and there are others that will come along, but we have a great relationship with the Tennessee Department of Health, who this funding is through. We would also love to partner specifically with county governments, the health departments, and health councils. The Southeast Tennessee Area Agency on Aging and Disability is key for us, along with all the senior centers, based on our target population of older adults and caregivers. Also, the Tennessee Rural Health Association. There are things that we can do to help support rural clinics and drive adults to those clinics where indicated. And then, of course, in general, our community organizations and stakeholders and healthcare providers who are already there doing the excellent work of taking care of our county residents. This is just a snapshot of our timeline as it sits right now, coming up on May of 2024, if you can believe it. We're looking forward to attending more community meetings as our schedule allows. We're getting our mobile health unit officially ordered, and then starting our community needs assessment, which will really run through the summer. But if we're honest, it'll probably be ongoing through the entire program. But we want to use a community needs assessment to help inform some of the programs that we're doing. We want to hear from you all and be able to craft our programs so that they're useful and helpful to everyone in your community. In June, we'll continue our program development and looking at those needs assessments, but we have several positions that we'll be hiring for this project as well. So we'll work through the summer, getting all of our ducks in a row, so to speak. In September, we will embark on a soft launch where, even though we don't have the mobile health unit itself, we will be able to visit some of your places in the community and provide some programs and get to know and build relationships with your residents and with community stakeholders as well. We expect the mobile health unit to arrive by November of 2024, which will allow us to do a full launch of our clinic programs in the spring of 2025. So most importantly, let's talk a little bit about potential programs. As I mentioned before, our goal is to support current providers and organizations. We will be able to provide basic primary care, health screenings, health education and prevention, some assessment and referrals as well. We will provide some memory screening clinics and work on referrals for those who need further evaluation for their memory. Medication reconciliation and consultation. If you work with older adults at all, you know that medications are not only challenging because of the amount that older adults tend to take, but the side effects, but most frequently the cost is a huge burden. So we'll be able to provide some consultation around medications as well. Food insecurity screenings, along with nutrition education and consultation, are always important in any community. It's challenging for anyone these days to afford healthy food, but also for older adults who are on limited income. So we feel like it's very important to help support communities where needed to provide more food security. As Erin Melhorn mentioned, occupational therapy is able to help us provide some balanced mobility and adaptive equipment assessments, as well as education and support. The CarFit program is a great example of things that can be done out in the community. We'll also, as a primary focus, look at caregiver assessment, education, and support, as well as social activities for both older adults and caregivers. It's so incredibly important that people are not isolated and have the opportunity, even if they can't get out of their home, to enjoy some type of social activity. And that may mean some digital work, some telehealth, or some digital training, assistive devices, Wi-Fi, things like that, so that people can tap in not only to social activities, but healthcare as needed. In the near future, we hope to be able to provide some services around mental health, vision, and hearing, but those won't be the first line items that we're standing up. This is just an example, some pictures of a recent event that we did in Monroe County, which is not actually on the county list for this grant, but we did a brain health event in March where we did some blood pressure screenings along with memory screenings. There was a local health department organization that was doing health risk assessments for older adults. It was very successful, and we had community organizations there for that warm handoff. So if someone was struggling with a particular need, we were able to get them to that organization and provide that one-on-one meeting and follow-up plan so that they had a plan when they left that day. So how you can help. As you all know, community needs assessments are incredibly important. And I know most of the counties are working on these from a lifespan approach as we speak, and have been for months. One of the things that we really want to focus on are the needs of our older adults and caregivers. And we want to focus on some of those social determinants of health along with physical health, and find those community resources that are available for whatever concern or condition a person or caregiver may have. And so to do that, we're going to be involved in, hopefully, you helping us out, lots of listening and understanding the benefits and the good things about each county, and then also where some of those challenges lie. This is just a schematic, and as we will send all of these slides out at the end, so you'll have all of the information that's presented on these slides, as well as the recording, so you'll be able to study this a little further if you like. But on the left side, you'll see where the first part of any conceptual framework for a community needs assessment is really just getting to know the community, looking at the identification of needs and the assets and priorities. And that's really where that red box is. That's where we sit. And by the end of this grant, which will last until the grant itself will last until 2026, but we will continue with these programs after as well. But we hope to transition over these next couple years through to the dissemination and improved population health. So we're looking forward to hearing from all of you. In your follow-up email, there will be a link to a survey or just a very broad few questions to get us started. As we go through this process, we'll get a little more detailed with our questions about community needs. But for now, we really just want to know what you think are the top priorities for older adults in your county, the good and the bad, as well as who you know and who we should know. So it won't take long to fill out, probably 5 minutes tops, unless you have a lot of information for us. And if that's the case, we would also welcome the opportunity to meet with you and discuss any particular questions or concerns or ideas or thoughts, things that have worked or haven't worked in your community. And we'll send a link to schedule that with us as well. So just to reframe, Our next steps include working through a community needs assessment, getting some of that information collected so that we can meet some of you and learn how we can best collaborate and develop programs that really make a difference for your older adults. We'll look towards our mobile health unit launch in the spring of 2025. And in the meantime, we hope to host quarterly meetings to inform you of our progress, the good and the bad, and to continue to build our relationship with you as people who are interested in this population. So with that, I'm happy to take some questions. I have also put our email up there. I'm sure Stephanie is putting our information in the chat as well. But if you have a particular question, I will do my best to answer it. You're welcome to come off mute and ask, and we're certainly open to hints and tips and smart advice as well.
Hello, this is Tony Fennell at Meigs County. Can you hear me?
I can.
Thank you. I was wondering what your visits may include, how many times a month or how many times a quarter, and how long would you stay in our community, or is it just going to depend on the health needs? Thank you.
That's a great question. To start, we know that the mobile health clinic will be out in a community multiple times a week. We are planning for the spring and fall semester of the university schedule. However, we've had some programs added on that are doing summer work as well. So we may be able to transition to a full year relatively quickly. You're right in that our stay will likely be on a daily basis, say from like a 10 to 2 or 10 to 4, just based on what the community needs. We are within about an 1.5 to 2 hour radius of all of your counties. So if the mobile health unit stays here in Chattanooga, we can be in those counties within a couple hours and then back. So some mobile health clinics find value in staying for a whole week, or multiple days in a week, just so if there's someone, for example, that has their blood pressure checked on a Monday or Tuesday, and they need some medication and the opportunity to get that medication, then we can recheck blood pressure later in the week. Some mobile health clinics will go 1 day per week instead, but just go multiple weeks in a row. So it really will depend on each county and what the needs are. But we're certainly open and flexible to scheduling the best we can to customize it for that county.
One more question. I'm really excited about this unit coming to our county, but our county layout is described much like a Band-Aid. It's long and slender. And would you be willing to go to a different community occasionally to check on those individuals? Because we do have a central located senior citizen group, but I'm not for sure if the extreme north and extreme south end residents is utilizing these services. So thank you for that.
Absolutely. That's another great question. One of the things that we'll do as we look towards getting to know the communities is figuring out where the best sites are, as we're not bound to a particular site, with the exception of we have to be able to go there in the mobile unit, be able to park in a good place and, safely for the people that will be coming to get services. So we can work with each of you who know the county well and get some ideas on where the best places would be. And then we'll evaluate those sites and make a visit to them. And I think St. Mary's may come to Meigs. So similar to their process for evaluating a site, figuring out where the best place is to be. Our goal really is to provide access to as many people as possible. So we don't really want to get kind of pigeonholed into one site or another, but at the same time, we have to be efficient with what we're doing as well. So those are things that will really depend on people like yourself to help us figure out where the most efficient but place to be is that will have the maximum impact. And we'll be flexible enough to change that from time to time as well.
Yes, and you are right. Meigs does receive care from St. Mary's. Is your unit going to be completely self-contained, or you need a location that offers restrooms for your employees or plug-ins to be shorelined into your rig, or is it, can you comment a little bit on that, what we may need logistical wise to hook you guys up?
Absolutely. So both. We will be self-contained, but to be at any place for any length of time, it would be helpful to have a site that has additional electricity to plug up to. I believe it will be equipped with full generator and all that good stuff. But as you know, if you're somewhere any length of time, it helps to have the ability to get out and stretch your legs or offer programs inside for groups. So I can provide more information as we know exactly what our unit is going to be. We're still in that process of procurement and looking at those applications, and we can work from there to see which sites make the most sense. Anyone else with questions? Those are all good ones.
Yes, I'm director at Etowah Area Senior Center. And what type of services will your mobile clinic provide? Like well checks, or will you prescribe medication, or will you, do testing, vaccinations? What type of services will you provide, and will you be billing Medicare for these?
So at the beginning, we won't be billing any insurance. We may get to that point as we get our feet under us. We'll be able to provide basic primary care along with, so that would include preventive health screenings, basic lab tests will be available from the mobile clinics, such as like your cholesterol or your blood sugar, blood pressure checks. We won't be doing procedures of any kind. So like surgeries, and at the beginning, anything that requires, needles or suturing up or things like that. But any of your basic health assessments we'll be able to do. And it's really broader than that as well. We can do assessments for occupational therapy. So looking at mobility and stretching, balance. We can do, as I mentioned, screenings for nutrition and consultations for that, as well as social type screenings, such as need for affordable housing and things like that. So basic primary care on the clinic itself. We have that ability to do lab tests and then get that information back. And so we will be able to write some prescriptions depending on pharmacy and things like that in the areas. We'll have to see where we dispense from. We won't have a pharmacy on the mobile health unit, but we can write prescriptions.
Okay, thank you.
Yes. I really appreciate all of you attending today. I know this probably generates a whole list of questions as well. It does for us too. And as I mentioned during the presentation, we'd love to chat some more. We can correspond by email. We'll be making some road trips to different counties over the next few months. So we'd love to reach out to you and just talk about the things you know and the things you'd like for us to know. So be on watch for a follow-up email that comes through with our slides, the recording, and then also the survey link. We would really appreciate your input as we work to make sure that we provide good stuff for your county.
Hey, Christy, I didn't want to get in the way of anybody's questions, but I do want to say how excited we are about this opportunity and thrilled to partner however meets that, is best for the mobile unit. So we'll be encouraging to community partners to participate in as many of these information sessions as possible too. But very excited.
Thank you so much. I appreciate that.
And I do have one question I thought of on the community needs assessment.
Mm-hmm.
Do you have a tool you're going to use? Are you developing the tool?
Yes, we have a specific assessment that we're looking at for caregivers as well as for older adults. As I mentioned, a lot of the community assessments that I know have been happening in each of the counties across the state have a lot of really great information. And we want to encourage people to take, to do those assessments. really where we're at right now is getting information from all of the people who work with older adults, not necessarily the older adults or caregivers themselves right yet, but we will get to that point. So right now we've got a broad survey that will be that beginning part of that needs assessment. And then we'll drill down a little bit more as we start getting into the communities where we can ask residents particular questions about, access to care and housing and all the good things that you're trying to get information on anyway.
Okay, thank you.
Mm-hmm. All right, everyone. Thank you again for attending. We will also send out information in probably a month or so with a follow-up meeting. Please feel free to share that information with any of your colleagues or people that you think might be interested. And we'll hope to have some spotlights that will be more informative for you as well, other than just us talking and updating you with our plan, but being able to highlight some of our community partners and things that are important to consider for older adults. So we look forward to building relationships in the future. Thanks so much.